According to the UNICEF, of the estimated 39.0 million, confidence bounds, 33.0 to 45.7 million, people living with HIV worldwide in 2022, 2.58 million, 1.91 to 3.47 million, were children aged 0 to 19. Each day in 2022, approximately 740 children became infected with HIV and approximately 274 children died from AIDS-related causes, mostly because of inadequate access to HIV prevention, care and treatment services. As of 2022, roughly 13.9 million, 10.6 to 18.4 million, children under the age of 18 had lost one or both parents to AIDS-related causes. Millions more have been affected by the epidemic, through a heightened risk of poverty, homelessness, school dropout, discrimination and loss of opportunities, as well as COVID-19. These hardships include prolonged illness and death. Of the estimated 624,000, 466,000 to 890,000 people who died of AIDS-related illnesses in 2022, 990,000, 67,000 to 140,000, or approximately 16%, of them were children under 20 years of age. So, how can we end up the HIV/AIDS issue? Sexual Reproductive Health and Right, SRHR, is so important to be explained.
What is SRHR? Sexual and Reproductive Health and Rights, SRHR, are the different human rights related to sexuality and reproduction, such as sexual health, sexual rights, reproductive health, and reproductive rights. Everyone is entitled to SRHR. It's an essential part of universal health coverage, which ensures physical, emotional, mental, and social well-being. How many people could SRHR impact? Most people who are denied SRHR are women, men, and young people living in poverty in developing countries. But this is an issue that people around the world face. There are approximately 4.3 billion people who lack at least one essential sexual or reproductive health service over the course of their reproductive life. Marginalized and underserved populations face greater barriers to sexual and reproductive health services, and challenges as a result. This includes LGBTQ+ people, displaced people and refugees, racial and ethnic minorities, people with disabilities, sex workers, immigrants, and indigenous peoples. How do people benefit from SRHR? We can prevent unintended pregnancies, improve maternal health outcomes, prevent and treat STIs including HIV/AIDS, and tackle associated discrimination and stigma. Ensuring women's and girls' sexual and reproductive health benefits everyone. When they have access to SRHR services during pregnancy, nutrition improves and survival rates increase for them and their children. Having the ability to plan whether to have children, how many to have, and when to get pregnant makes women and girls more likely to stay in school, have more employment opportunities, and fully participate socially and politically. How can we ensure everyone has access to SRHR? Comprehensive sexuality education is critical to ensure that young people know about their bodies and their rights. Increasing access to a range of modern contraceptives, particularly for women and girls, gives individuals the power of choice and control over their futures. Ensuring access for everyone who needs it to maternal and child health services prevention and treatment of HIV and other STIs, safe abortion services, and psychosocial support can help save lives and strengthen communities. Why invest in SRHR? Investment in SRHR is proven to improve health and well-being and reduce poverty and inequality, while also promoting economic growth and positively impacting families for generations. It is estimated that in low and middle-income countries, it would only cost $12 or less per person annually to meet all women's needs for contraceptives and maternal and newborn health care. How can we take action? Global citizens must raise our voices and tell leaders in our communities and at the local, regional, and global level to increase respect for SRHR, especially for women and girls. Support greater investment in SRHR services for the most marginalized and vulnerable communities, and empower young people with accurate information and education about human sexuality. The more we learn about sexual and reproductive health, the better we will be to demand to protect our human rights and those of others.
The term Sexual and Reproductive Health and Rights, SRHR, was explored nearly 20 years ago at the Cairo International Conference on Population and Development, ICPD. 11 and the 1995 Fourth World Conference on Women, FWCW, 12 held in Beijing. Building on the World Health Organization's definition of health, the Cairo program defines reproductive health as a state of complete physical, mental, and social well-being and, not merely the absence of disease or infirmity, in all matters relating to the reproductive system and to its functions and processes. Reproductive health therefore implies that people are able to have a satisfying and safe sex life and that they have the capability to reproduce and the freedom to decide if, when and how often to do so. Implicit in this last condition are the right of men and women to be informed and to have access to safe, effective, affordable, and acceptable methods of family planning of their choice, as well as other methods of their choice for regulation of fertility which are not against the law, and the right of access to appropriate healthcare services that will enable women to go safely through pregnancy and childbirth and provide couples with the best chance of having a healthy infant, para 72. Furthermore, the Cairo Program of Action clearly spells out the concept of reproductive rights in Chapter 7, which states in part that such rights rest on the recognition of the basic right of all couples and individuals to decide freely and responsibly the number, spacing and timing of their children and to have the information and means to do so, and the right to attain the highest standard of reproductive and sexual health. It also includes the right of all to make decisions concerning reproduction free of discrimination, coercion, and violence as expressed in Human Rights Documents. Point 13. While governments would not name sexual rights or sexual orientation explicitly at the Beijing Women's Conference, the result and the process proved more useful than anticipated. A change in norms had been underway in international law since then, as evidenced by the growing body of documentation and commentary on these issues at the UN and in regional human rights forums. The Platform for Action, which was adopted by 189 delegations in Beijing, reaffirmed the Cairo Programmer's definition of reproductive health and advances women's wider interests, especially in the area of sexual rights. Paragraph 96 states, "The human rights of women include their right to have control over and decide freely and responsibly on matters related to their sexuality, including sexual and reproductive health, free of coercion, discrimination, and violence. Equal relationships between women and men in matters of sexual relations and reproduction, including full respect for the integrity of the person, require mutual respect, consent and shared responsibility for sexual behavior and its consequences." While there were reservations expressed in relation to the sections on reproductive health, the FWCW broke new ground in such areas as violence against women, elevating the issue from a private domestic concern to a level of public policy, and broadening the definition to include acts previously justified in the name of culture and tradition. Women's rights as human rights and women's sexual rights as part of her human rights, and the rights of the girl child, to name but a few. 14. SRHR as human rights. The Universal Declaration of Human Rights, 1948, and the agreed treaties establish that human rights apply to everyone and that no one should be excluded. They identify that SRHR entails not only the absence of reproductive or sexual illnesses, but also the full enjoyment and well-being of sexual health. 15. SRHR, as part of human rights, have the following principles of human rights described in the Universal Declaration and outlined by the United Nations Population Fund, UNFPA. Universality, they apply equally to all persons and they are the rights of every individual, there are no exceptions. This means that SRHR apply to everyone, including all children, adolescents and young people. Inalienability, this means that you can never lose your rights. You have them, from the moment you are born, because you are human. Indivisibility, no right is more important than another right, they are all connected and you cannot have one without the other. Denial of one right impedes the enjoyment of the other rights. Interdependence and interrelation, the fulfillment of one right may depend in part or in whole on the fulfillment of other rights.